My name is Marcia Rigel, and I'm a member of SEIU, and I'm also a registered nurse at West Boca Medical Center. When I was told by SEIU that they were having this town hall today about Medicaid expansion, I said I would come.
Welcome. This is a great turnout for the middle of the week. And I'm State Senator Sobel, and I'm chair of the Broward delegation. And we welcome you to this town hall meeting on moving forward to access health care in Florida.
I want everybody to have health care. And so I have been to Tallahassee rallying our legislators, trying to get them to pass this health care bill. I've been back and forth since March trying to get them to pass this.
If you have ever attempted to purchase insurance, raise your hand. Okay. If you know someone who's uninsured, raise your hand.
I've not been employed since June 10th, 2011, and as a result, I'm in the process of losing my house. I've lost 2 cars, I've spent my life savings, and I'm unable to continue COBRA coverage, which I had through my employer. I'm presently uninsured. In this past November, I developed a golf ball-sized mass on my neck, very painful and hard. And when I went to the doctor, he looked at me with eyes like it was the end of the world. I said, oh my God, what's that? And it scared me. He didn't know my income situation. He suggested that I have a needle biopsy. It took 6 weeks for them to find a physician who would see me and do a needle biopsy. When I got the results back, they were inconclusive because the sample size was too small, but they saw cells that were abnormal. And I was referred to a surgeon. It took another 6 weeks to find a surgeon that would see me because I had no health insurance. That surgeon couldn't treat me because he couldn't feel the mass. And because of where it was too dangerous to go in and look around and remove tissue. So as of now, I'm waiting to see.
If you know someone who is insured but has a challenge paying for their insurance, raise your hand. These are not issues that are foreign to the everyday person.
Colon cancer runs in our family. My mom died a few months later. I got on Medicare a couple years ago and I had my first free colonoscopy.
My name is Dr. David Perloff. I'm a cardiologist. I'm the treasurer of the Broward County Medical Association and will soon be president. I'm assuming that nobody who's sitting in front of me has ever sat waiting in an indigent care clinic for care. And I'm assuming that nobody that voted against Medicaid expansion has ever done so either. The gentleman I met for the first time, I was seeing him for clearance for surgery. He has a melanoma that was discovered 3.5 months ago. This is a gentleman who worked for 30 years at the same job and during the economic downturn was let go. He told me it would cost him $400 a month for his COBRA insurance, but he couldn't afford it because he couldn't afford his water bill.
If your reason for going to the emergency room was because you have a broken leg, well, in order to get it fixed, they don't fix it in the emergency room. You have to go to an orthopedic doctor or a surgeon that's going to do surgery to fix that leg. And that happened with my daughter. She was hit by a car while she was going to catch the school bus. Lucky for us, we have insurance, and so I was able to follow up with her. And that was very expensive. One day in the emergency room was $10,000. Night in the hospital was another $10,000, and that did not include the doctor's fees. That was just the hospital. The surgery was more. I mean, it adds up, in other words. So if we don't have insurance, we won't be able to pay those bills. We won't be able to follow up and have the care that we need.
You know, as I sit here and I think about the ability of the Senate to come together, to come to an agreement, as Senator Smith said, where everyone was not happy, but they came to an agreement that would draw down $51 billion for health care, that would ensure over 1.2 million people health coverage here in the state of Florida. That's what's at stake.
The $52 billion that we gave our taxpaying dollars for, that is going to go to another state, should come back to Florida. We need it. There's 1.2 million Floridians that are hard-working people. They work in the food industries, they work in jobs such as healthcare, or many of the other occupations in our state. They're working. They're not sitting at home doing nothing. They're working. They're students. They need that money to help them so they can also have healthcare.
If the governor say he support Medicaid expansion, I ask that he prove it.
Thank you.